Good morning. طلاب المرحلة الثالثة كلية الطب. معكم دكتور حيدر سعدون قاسم, consultant physician. Our lecture today about dysphagia. What's dysphagia? It is difficulty in swallowing. The act of swallowing involves three phases: oral, pharyngeal, and esophageal. Swallowing takes about 10 seconds. Before swallowing begins, oral preparation of the bolus must occur. So this is oral phase, this is the bolus, this is pharyngeal phase. Physiology of swallowing: pharyngeal and esophageal phase. This is slowly descending of the bolus and the esophagus, as seen by this diagram. Evaluation of patient dysphagia: you should have history, review of system, physical examination, and imaging study history. Duration of dietary changes, weight loss, odynophagia, painful swallowing, difficulty to solid or liquid is very important. Level of sensation of dysphagia, from which we can decide the site of difficulty in swallowing, the site of pathology. Past surgery to head and neck, trauma, ingestion of acoustic substance like chlor, which can cause dysphagia in the lower part or middle part of the esophagus. Associated symptoms such as GERD, gastroesophageal reflux disease. Voice change is very important, especially those with heavy smoker. Herald, underlying serious pathology like malignancy. Nasal leakage, otalgia, localize the pathology near the ear. Review of system: ask about common systemic process associated with dysphagia. Tobacco, alcohol, medication, antihistamine, anticholinergic, all can cause dysphagia. OI changes of the cervical spine, systemic neuromuscular disorder or disorders like multiple sclerosis or autoimmune diseases that affect the central nervous system. Autoimmune disorder, and very important to exclude, is psychiatric diseases. Physical examination: generally body habitus, mental state, drooling, wheezing, dyspnea, voice quality, very important. Mental state, drooling of the saliva from the mouth, wheezing, and shortness of breath. Cranial nerve examination to exclude central cause of dysphagia. Inspection of the tongue and palate for symmetry to exclude motor neuron diseases. Pharyngeal examination: pooled secretion, vocal cord movement, to exclude any mass or pathology in this area. Imaging study should be chosen to suit the patient's symptom and to confirm the diagnosis. We have a plain X-ray. From this plain X-ray, we can see here the inflamed epiglottis, epiglottitis, one of the causes of dysphagia. Barium esophagus, use structural disorder diagnosis. Example: dysphagia for solid food, can be used with air contrast. This is normal. Barium with air contrast. This is fungal infection of the esophagus, could be seen in patient taking steroid for long period or immunocompromised patient like HIV. This is corrosive ingestion, can result in multiple stricture. This is esophagus, this is barium. This is the stricture, could be due to ingestion of corrosive material like chlor. Manometry, used to assess motility disorders of the esophagus, achalasia, esophageal spasm. This is the manometry. You notice there is different pressure at different part of the esophagus, upper, middle, and lower part of esophagus. Use bolus scintigraphy. Bolus scintigraphy used to follow improvement in patient with history of aspiration and patient with achalasia. Time for bolus to move from one side to other, and this time can be assessed by bolus scintigraphy and to assess motility disorder of the esophagus. Ultrasound, usually portable tool for dynamic study, especially in children. Ultrasound can be used to also assess any mass on pressure to the esophagus from inside or outside. Modified barium swallow. Modified barium swallow is a study in which puri liquid and or solid consistency barium is administered in a varying amount, while the fluoroscopy imaging lateral anterior aspect is recording on videotape for lateral view and analysis. So here we can assess the movement of the esophagus and the bolus movement or liquid material, and you can see them. You can see this by CT or X-ray fluoroscopy. X-ray fluoroscopy. Fiber optic endoscopy for evaluation of swallowing difficulty. Here we can see the esophagus, and this is the vocal cord. We can see the vocal cord here. Trachea. Disorder that cause dysphagia. We have foreign body. This foreign body can cause dysphagia. This commonly occurs accidentally in children. Tracheostomy as a cause of dysphagia, and this tracheostomy usually put the patient in the intensive care unit, whatever the indication is. Craniopharyngeal achalasia. This is clear narrowing of the lower part of the esophagus. Prominent craniopharyngeal segment. Zinker diverticulum. Zinker diverticulum is assessed by barium swallow, and this diverticulum causing dysphagia. At this site, accumulation of food can occur, and even bad odor of the mouth occur. Cervical spine disease, one of the causes of dysphagia, pressure symptom. Esophageal web and ring. This is usually needs surgical intervention and discovered by endoscopy. Stricture caused by caustic ingestion. Caustic ingestion like drugs. Top of the drugs is doxycycline, and corrosive material like chlor, ingestion accidentally or at suicide attempt. Achalasia. Achalasia, loss of mesenteric plexus of the lower part of the esophagus. This is rat tail appearance shown by barium swallow, and this is a hugely dilated lower part of the esophagus, usually after the stenosis. Diffuse esophageal spasm. This is manometry, and from which you can see the different pressure area and different site of the esophagus, and this reflects systemic disease affecting the esophagus, most likely here in this case is systemic sclerosis, which causes diffuse esophageal spasm. GERD, gastroesophageal reflux disease, as a cause of dysphagia. Chronic GERD can lead to parrot esophagus. Parrot esophagus can lead to dysplasia of mucosa, and a nocturne can cause malignancy. Cancer, this is mass obstruction in the lower part of the esophagus, one of the differential diagnoses of dysphagia. So dysphagia, difficulty initiate swallowing, blood choking or aspiration, oropharyngeal dysphagia. We localize the site of pathology. We need video fluoroscope, swallowing assessment, and neurological assessment to exclude pulpar palsy, lower motor neuron, pseudopulpar, upper motor neuron, myasthenia gravis. Dysphagia, food sticking after swallowing plus regurgitation. Esophageal dysphagia, need endoscopy, assess this motility, manometry, achalasia. Esophagitis, peptic ulcer, candidiasis, eosinophilic infiltration. Stricture, benign, peptic ulcer, fibrosing or malignant, you should exclude malignancy. Systemic cause of dysphagia, stroke, about 50% of patients, amyotrophic lateral sclerosis, Parkinson, multiple sclerosis, muscular dystrophy, and myasthenia gravis. Autoimmune disease as a cause of dysphagia, systemic sclerosis at the top of the list, SLE, dermatomyositis, mixed connective tissue diseases, mucosal pemphigoid, epidermolysis bullosa, Sjögren syndrome, xerostomia, dryness of the mucous membrane of the mouth, rheumatoid arthritis, cricoarytenoid joint fixation, pressure symptom. Aging, dysphagia part of aging, 2% of patients above 65, poor dentation, loss of tongue connective tissue, increased pharyngeal transit time. So dysphagia is part of aging. Globus hystericus. What is globus hystericus? Globus hystericus, it is a psychological problem. Usually the patient is young age, female, and she imagine imaged there is abnormal sensation during swallowing. This is considered as somatization disorder. Feeling a lump in one's throat, this persistent sensation of having phlegm, a pull, or some other sort of obstruction in the throat when there is none. Swallowing can be performed normally. All the investigation should be normal. One may also feel mild chest pain or even severe pain with a clicking sensation when swallowing. So, globus hystericus, it is diagnosis of exclusion. It is disease of young age, especially female. All the investigation negatives. The only treatment modalities for those patients is reassurance and even psychiatric consultation. So in a brief, at the end of the lecture, dysphagia is serious condition and usually underlying serious medical causes. So it is one of the important red flag in patient with dyspepsia. Thank you very much.